Thank you so much for joining us here on Idaho Today. As the Treasure Valley's population is ever growing, so is an increased need in medical services, particularly in regards to cancer care. Catching cancer early is paramount to a successful outcome, but in some cases, surgery is the recommended path of treatment for patients who have been diagnosed. Dr. Lee Stockton is a fellowship-trained oncology surgeon at SaintAlphonsus in Boise, who joined us to talk about the kinds of cancers that she treats, as well as the ways that early detection can help save lives. Dr. Stockton, tell us about the surgical oncology program at SaintAlphonsus.
Absolutely. So the surgical oncology program has been rapidly expanding. Surgical oncology focuses on the surgical treatment of all types of cancers. And so I did subspecialized training in surgery after my residency to focus on the care and the multidisciplinary approach to treatment to all sorts of malignancies. We have specialty care now in treatment of all aspects of cancer.
Okay, and you said all aspects of cancer, but what are some of the types of cancers that you treat specifically, and are there certain ones that are actually more common here in Idaho?
Yeah, so my area of interest is in the focus and management and treatment of liver cancers, so that's primary liver cancers, as well as spread of other cancers like colon cancer to the liver, as well as pancreatic cancer, melanoma, and sarcomas. And in response to what you asked about, are there cancers that are more prevalent here in Idaho? Melanoma in particularly has a higher incidence, a higher rate here in Idaho, and the numbers that we found is actually people do overall worse than the nationwide average. And so that's an area that I'm particularly passionate about to really focus on and help hopefully fix.
Yeah, okay. And then when it comes to these cancers, especially melanoma, like you're stating, how do people catch these cancers early enough when they're most treatable? Are there certain signs, maybe some screenings?
Yeah, so, everybody knows about colon cancer screening. What they may not be aware of is updated recommendations that people should be getting their colon cancer screening at age 45 now, not age 50. And that's either a colonoscopy or the Cologuard test, and that should be everybody. And then women age 40 and above should be getting their mammograms as well as their gynecologic screenings. And then, especially if you've had a lot of sun exposure, see your primary care doctor, talk to a dermatologist about doing a head-to-toe skin exam to check for abnormal appearing moles. And if you do have something that is worrisome, don't ignore it. Cancers are easily treated when they're caught early, but if left too late, then we start running out of options of ways to manage it.
I'm so glad you mentioned if you see something that's worrisome, don't question it. Just go get it looked at. And if it turns out to be nothing, then great.
Exactly.
But at least you know, right?
Right.
And then also the peace of mind as well. You don't have that sitting kind of in the back of your head.
Yeah.
But let's say you are diagnosed with something and you do need surgery. You need to have some kind of surgical procedure done to treat that cancer. What are some of the approaches that SaintAlphonsus offers?
Yeah, so we do a very personalized approach. Whenever we meet the patient, we have our multidisciplinary conference, which is where we get our medical oncologists, the radiation oncologists, radiologists and pathologists and surgeons all in a room to talk about different cases and come to a consensus so everybody's on the same page. And then when we actually, if you do have a cancer that needs to go to surgery, we offer a very wide range of modalities to treat it, including open approaches as well as minimally invasive approaches like robotic surgery as well as endoscopic therapy sometimes when indicated.
Okay, and so this sounds like a pretty customized approach. What's the benefit of that?
The benefit, especially for the minimally invasive approach, it's less pain, faster healing times, less time in the hospital, and if, additional therapy like chemotherapy is needed, you can get on that additional therapy faster.
Yeah, and imagine too, this advanced level of care that SaintAlphonsus offers is beneficial not only to the patient, but also their family as well, right?
Absolutely. So before I started, a lot of these cancers were not able to be treated here. And so people were having to travel to get their care. And so having to drive 5 to 8 hours away to receive a surgery is a huge disruption for not just the patient who, if you think about it, it's more of a disruption for the family who has to take time off work, find a place to stay because they can't live in the hospital like the patient is going to be.
Yes.
And then if, God forbid, there's a complication from surgery, they're once again left far away from their treating surgeon.
Yeah.
We're now able to keep that here at home where patients can feel more comfortable, have their support systems close by, and really, keep care here in the Treasure Valley.
Yes, and that impact is huge. I can only imagine what that does to the outcome, right? The ability for that patient to heal, the ability for that family to possibly even have the procedure done.
Exactly.
Yeah.
There's much more continuity of care.
Yes.
The whole team is in one place, and so there's less scrambling to find records or figure out what was done elsewhere. And it really does have a big impact on the patient and their recovery and treatment going forward.
Yeah, a much better outcome, right?
Yes, absolutely.
Yes. So if those watching are interested, they need to learn more, where can they go?
They can go to our website at SaintAlphonsus.org.
Wonderful, thank you so much.
Thank you.